Hi, my name is Judy Lee. I'm a PhD candidate in the Lisa Konofagu's group at Columbia University. And today I will be talking about a real-time harmonic motion imaging guided focused ultrasound method in vivo breast cancer mouse model and patients. Focused ultrasound therapy can achieve tissue death through thermal or mechanical ablation, and it is an alternative to chemical and molecularly targeted therapeutic approaches, which is particularly advantageous in cases such as triple-negative breast cancer, which may be less responsive to these other methods. Previous studies have shown immune modulatory effects of FUS monotherapy, which is FUS therapy on its own, particularly with partial FUS ablation, in which a partial volume of the tumor is ablated. However, to our knowledge, no studies have shown complete pathological response of FUS monotherapy in TNBC models, and there's also a need for real-time monitoring of FUS ablation. Harmonic motion imaging is a radiation force-based ultrasound elasticity imaging technique that can measure tissue displacement by inducing oscillatory tissue motion. Our group has shown HMI for ablation monitoring, termed HMI-guided FUS, in which HMI measures mechanical tissue property changes that occur due to FUS ablation. And our group has also shown HMI for imaging applications, in which HMI can measure mechanical properties of soft tissues. The objectives of our study is to first demonstrate feasibility of real-time HMI-guided FUS monitoring for predicting ablation response. And our hypothesis here is that HMI-guided FUS can be used to detect the onset and extent of ablation lesioning. And our second objective is HMI longitudinal monitoring of mechanical tissue property changes following FUS ablation, with the hypothesis that by monitoring displacement changes, HMI longitudinal imaging can be used to assess the presence of tumor growth and recurrence. For this study, we used a longitudinal mouse study and a patient study. For the mouse study, we had 6 9-week-old female biopsy mice that were implanted with 421 luciferase orthotopic tumors on both flanks. 421 luciferase mouse model was used because it's a TNBC model, and it could be used with bioluminescence imaging of the luciferase enzyme. And we used the IVUS imaging system for bioluminescence imaging. For this study, tumors were ablated on one flank only so that the contralateral flank can be used as a negative control. And one mouse was used as a negative control and received no FUS ablation at all at either of the flanks. For the patient study, one 47-year-old female patient with invasive ductal carcinoma was recruited to our study, and as according to our clinical protocol, HMI-guided FUS was applied immediately before scheduled segmentectomy. This is our timeline for the longitudinal mouse study, with day 0 defined as a day of FUS ablation. 3 days before FUS ablation, IVUS imaging was performed. Then at day 0, HMI-guided FUS ablation was performed at only one lesion location inside of the tumor volume, and IVUS bioluminescence imaging was performed immediately after FUS ablation. From day 7 to 35, or every week following FUS ablation, HMI raster scan imaging and IVUS bioluminescence imaging was performed. This is our HMI-guided FUS and HMI imaging setup. We had a single element focus transducer and an imaging transducer that were confocal. And again, I'd like to emphasize that only one FUS lesion site was one FUS ablation site was lesioned. There was no raster scanning of FUS, and the durations of FUS were operator dependent based on real-time monitoring. For longitudinal HMI imaging, the transducers were mechanically rastered with a lateral step size of 0.4 millimeters and axial step size of 2 millimeters. For real-time HMI data processing, a set of RF frames were processed at a time with the following pipeline in order for these RF frames to be displayed in real time across the ablation duration. And the total time for processing, displaying, and saving this data was around 4 seconds. For longitudinal IVUS, these are the results from longitudinal bioluminescence monitoring. With again, HMI-guided FUS ablation at day 0. We can see at 3 days before ablation, the tumors had around a similar level of luminescence on both flanks. And then starting at day 0, we can see that the tumors that were ablated have a lower level of luminescence compared to the non-ablated tumor, in comparison to the control tumor in which both flanks show a similar level of luminescence. Then from days 7 to 35, we see that the control mouse had a similar level of luminescence again between the left and right flanks. However, in the mice that received ablation, among those mice, for mouse 2, we see that there was a decrease in tumor volume as assessed by, there was no recurrence in tumor volume as assessed by gross pathology, and there's also no recurrence in luminescence as assessed by bioluminescence imaging. from day 7 to 35. For mice 3 to 6, we see that there is an initial decrease in luminescence and tumor volume, but then there is recurrence in tumor volume and luminescence at subsequent time points. I'd also like to note that for luciferase imaging only shows luminescence in a live tissue. And so for this mouse model, we know that necrosis occurs when the tumors reach a certain size. And so at this time point, even though a tumor volume can be assessed with gross pathology, there will be no luminescence at these time points. Here are the results from real-time HMI-guided FUS monitoring in the mouse with complete remission. We see on the left the B mode acquired over the ablation duration. In the middle, the peak displacement, which is calculated as the HMI peak displacement at each pixel. And then the subtraction map, which is the HMI peak displacement of the subtraction of the current HMI peak displacement frame from the initial peak displacement frame to show the difference in displacement over time. On the bottom, we show plots of the mean ROI displacement from the peak displacement HMI images. And we see an increase at ROI1, which is at the FUS focus, initial increase in displacement followed by a subsequent decrease in displacement, which indicates first lesion heating and then lesion stiffening. And the presence of ablation is further confirmed by bioluminescence imaging, which shows a lack of luminescence immediately after ablation of the treated tumor. Here are results from the mouse that showed partial remission. And again, we see an initial increase in displacement and then a decrease in displacement at the focus, which again is confirmed by IVUS luciferase imaging. Here are longitudinal HMI displacement monitoring results of the control mouse. And as expected, we see over time that there is an increase in tumor volume and a decrease in HMI displacement, which shows stiffening over time. Here are longitudinal HMI displacement monitoring results in the mouse that exhibited a complete remission. In the ablated tumor, we see at day 7 that there appears to be a lesion in the B mode, but in the HMI displacement map, we find that this lesion is actually softer than the surrounding tissue. And then from days 14 to 35 onwards, we do not see evidence of a lesion in the B mode or gross pathology, and we see a region of soft displacement. In the untreated tumor, we again see an increase in tumor volume and decrease in HMI displacement over time. For the mouse that received partial remission, in the ablated tumor, we see that there is debulking of the tumor. However, interestingly, we see that the HMI displacement does not soften at these time points, but is instead fairly stiff throughout these time points. And then again, in the untreated tumor, we see both tumor volume increase and HMI displacement decrease. These are the combined metrics from across all of the mice. On the left, we see the cross-sectional area, which was calculated manually by B mode. And we see in the complete remission mouse that there is a decrease in the cross-sectional area that does not recur over time. And in the partial remission mice, we see an initial decrease in tumor volume followed by an increase in tumor volume. And in the left untreated tumors, we see a similar rate of growth in cross-sectional area or tumor volume over time. In the middle, we see mean HMI displacement in the right ablated tumor and left unablated tumor. In the right tumors that were ablated, the mouse that showed complete remission shows higher HMI displacement at time points 14 and 21 compared to the rest of the mice. And in the left untreated tumors, we see a decrease in displacement for all of the mice. On the right, we see tumor radiance. And we can see that from days -3 and 0, there's a decrease in radiance in all of the mice except for the control mouse and one of the partial remission mice of the ablated tumor. And in comparison to the unablated tumor that shows an increase in radiance between days -3 and 0. Lastly, I want to show the results of the real-time HMI-guided FUS monitoring in the patient with IDC. The tumor is circled in red, and it was found by locating the hyperechoic clip that was placed prior to surgery, as you can see in the middle of the red boundary. And again, here we see an increase in displacement followed by a decrease in displacement, which indicates lesion formation. And this can be clearly seen in the subtraction map, which shows a region of displacement difference between the current and the initial frame. So in conclusion, our first aim was to demonstrate feasibility of real-time HMI-guided FUS monitoring for predicting ablation response. And we showed that HMI-guided FUS showed displacement decrease or stiffening during ablation, indicating lesion formation. And our second aim was HMI longitudinal monitoring of mechanical tissue property changes following FUS ablation. And we found that controlled tumors and tumors that recurred following ablation decreased in HMI displacement over time. However, the tumor with complete remission softened over time. So this indicates preliminary potential of HMI as a biomarker for tumor response to FUS treatment. And I would also like to highlight that we did see complete remission of the tumor of one mouse following FUS ablation, which shows preliminary potential of FUS as a monotherapy treatment. In the future, we would like to investigate different AM frequencies for HMI imaging and HMI-guided FUS ablation for improved monitoring. And we would also like to investigate the immune modulatory effects of FUS ablation. I'd like to thank our funding sources, members of our lab, and also the CUIMC Herbert Irving Cancer Center for supplying us with our mouse model. And thank you for listening.